name is Devin Warman and I'm a physical therapist at Loudon Sports Therapy Center. Today I'm going to discuss the difference between hip bursitis and hip tendonitis. Many people are easily confused because some of the signs and symptoms kind of cross over and they are similar to each other. So the first thing I wanted to go over is, what are they exactly? So what's a bursitis? Bursitis is technically an inflammation of a fluid-filled sac around a joint, and in this instance it would be around the hip joint. The bursa sac has an area within that fluid where other structures will go through them, such as bones, tendons, and muscles. So it kind of encompasses that entire area, and when that happens is it gets irritated. So what's a tendonitis? A tendonitis is usually something that occurs over time due to repetitive stress. Something like running or doing a lot of exercise that involves a lot of the same movements, and that involves a tendon. What is a tendon exactly? A tendon is an actual attachment that connects muscle to bone. So if you think about going up and down the stairs, hip tendonitis would involve a tendon in the front of the hip there that involves lifting up the legs. That's the way it's used. So it has to do with active movement. That's the difference between what a tendon is and what a bursa is. So what exactly is the difference between the two and how do they present? So you can kind of get an idea of why one may be more so what you're dealing with versus the other. So with a bursitis, generally speaking, a lot of the pain that someone will feel will be along the side of the hip here, and occasionally it can radiate down a little bit. So very commonly, someone will have trouble laying on their side at night and have a lot of trouble sleeping because it's too uncomfortable to lay on that side. The other thing is it may be a little bit warm and a little bit swollen because it is a fluid-filled sac. So you may notice a little bit of not just the tenderness there, but also a little bit of warmth compared to other regions of the skin around that area. For tendonitis, the common symptoms are also thigh pain, but more than likely it's going to be the front of the thigh area, not as much the side, and it's usually worse with activity. So you may notice if you are doing a lot of stairs and it's the same movement over and over again, then the pain is going to be kind of in the attachment site of where that tendon is connecting to the bone, to that muscle. So you feel it a lot more in the front. The biggest thing is if you are an avid exercise person and you're doing a lot of the same exercises, you may then irritate that tendon in the front and feel that. If you're not an avid exerciser and you decide to take up some kind of exercise and you progress too quickly, that puts too much stress on that tendon because you're doing a lot of new movements that it's not used to doing, and therefore you would have pain in the front of the leg. Usually there's no warmth involved because it is the tendon, but definitely tenderness in the front, you can pinpoint it and touch it near the bone, versus that bursa where more likely it'll be on the outside of the thigh, and then you would have some of that warm sensation and tenderness, especially with sleeping. So now you're probably wondering, what can you do about it? So a lot of people will go onto the internet and look up a bunch of information, and let me just tell you, there's a ton of information out there, but the thing is, just because it may sound like something that you have, your treatment might be slightly different from someone else's treatment. The biggest thing is when you first have a lot of pain, you kind of want to manage that pain, so it's super important to rest. You do not want to continue performing any of the activities that are making those symptoms worse. You also want to do some ice to the area, especially the first week or so. That'll calm down the irritation, whether it is a bursa or the tendon. It'll calm it down enough where you're feeling a little bit better, and then you would want to do some stretches. Also, occasionally people will like to take anti-inflammatories like NSAIDs because that will decrease the inflammation. The biggest thing though is, yes, you can do ice at home. You can definitely take some NSAIDs, and rest is super important, all of which you don't really need information about. The biggest thing though is, where do you go from there? And that's where a physical therapist comes into play. If you are having pain, you don't want to ignore it. You actually want to deal with it right away head on. You want to find out, what is the source of the pain? Is it a bursitis? Is it a tendonitis? Then you want to figure out exactly what exercises you want to do to improve your pain, get you back on the road to recovery. So There are lots of stretches that you can possibly do, but a physical therapist will actually do a really thorough evaluation and figure out exactly which stretches and exactly which exercises you should be progressed to doing at the appropriate time.